Sounds good. Thank you, Ashley. So everybody knows where they're at. We are welcome to the Rise and Thrive webinar series, and today's webinar title is Facilitating Community Change, Translating Campus Community Partnerships to Broader Community Work. As a reminder, I have to do my spiel every time. The Rise and Thrive project was developed through funding from the Governor's Emergency Relief Fund under the Corona's Aid, Relief, and Economic Security Act, otherwise known as GEERS. And OCI, the Ohio College Initiative, is housed at Prevention Action Alliance and is a partner in this project with the Ohio Department of Mental Health and Addiction Services, Prevention First, the Ohio Program for Campus Safety and Mental Health, and the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery, otherwise known as HEC AOD. And that was a tongue twister. The Rise and Thrive webinars, as you may know, were developed to promote campuses and communities working together to provide the opportunity to engage with state and national experts on topics that promote campus and community partnerships and enhance student wellness. As Ashley said, CEs are being offered today. Webinar recordings will be available on the Prevention Action Alliance website under the Ohio College Initiative, under the Rise and Thrive tab, so that you can share them with your networks or go back and review them for additional reminders. Our final webinar in the phase 1 of this project will be May 11th, same time, same sandbox, and you can also find the registration for that on the Prevention Action Alliance website under the OCI tab. So I want to begin by welcoming our guest speaker today, who I think you're really gonna like. Her name is Jennifer Skolaski, and she is the owner of Community and Nonprofit Leadership Consulting. And then I will let her take it away from here.
Awesome. Thank you so much. Welcome, everyone. It's what day? Wednesday. Hooray. So I'm going to be honest and say that webinars are really hard because you don't get to see people's faces. And we're going to be talking about relationship building, and I don't get to see any of your faces. So I have to do one silly activity and just like hold on, because I know how often people hate when like speakers are trying to be like participatory and getting people to act. But I need like a little bit of who you are so that I make sure that I'm saying, connecting with you all in some way. So could you do me a favor? And in the chat, could you I'm going to put this agency, what agency you're with or represent, and over or under. And let me show you what I mean. You ready for this? Hold on. Toilet paper. Are you an under or are you an over? So start putting your agency name and which way you like to put your toilet paper, because I feel like this is a lot of household fights for people. Yes, over, okay. Under, I don't care. Sandra, I love that response, because when I did this with my team, there were so many people that said I had no idea or I didn't care. Over, doesn't matter. Under, I suppose. I should have asked if people make you, like if there's somebody in the household that requires, daughter doesn't anymore. If there's someone in your household that requires it to be a certain way or not. I love it. Prefer over. Okay. Thank you so much, all. I love it. Now I know a little bit of who you are. I have to say, I was actually in Ohio last summer. My daughter is obsessed with Fiona the hippo from the Cincinnati Zoo. So we took, after COVID, during COVID, our first family road trip, and it was to Cincinnati Zoo to see Fiona. So hooray. I'm so glad to be here today. Let me go back to this. All right, can everyone see my screen? Ashley, can you tell me yes or no?
Yes.
Okay, awesome, thank you. So Juliana offered the title of this seminar, and of course it's long and wordy, but the reason why it is, and I'm setting my timer to make sure that I stay on time, The reason why it is because there are a lot of these pieces that I do in my day-to-day work. So I facilitate a lot. I work on campus community partnerships, and my broader work is working with the community on a lot of different things, but it's all with the goal of community change. So today I'm going to offer some background about who I am so you can find out if it's actually relatable to your own journeys. Talk about boundary spanning, and I'm not sure how many of you have heard about boundary spanning before, but talk about the research that I did as part of my dissertation almost 10 years ago on campus community partnership work. I'm going to also talk about the broader application of campus community partnerships through overdose fatality reviews. So that's a big part of my work that I do now, something I'm really passionate about. Talks about a lot of prevention that I know a lot of you all are working on, and end with some tips and tricks that may be helpful for you. At the end, there's going to be time for Q&A, but as Ashley and Juliana said, please use the chat box, and I'm going to bring it down so that I can, I love that someone wrote Fiona is the best, for sure. So if you have any questions, please interrupt me. You know, like I said, I want this to be as participatory as possible, but I know that's really hard through a webinar. So I'm going to start with who the heck am I? So I love this energetic, optimistic go-getter. I've been called the Energizer Bunny many of times, but I have to say I'm not your traditional academic. I've always had this strong passion and commitment to working in the community. It was important to me that when I finished my degree that I would take what I had learned in the classroom and apply it to the real world. I wanted to be this practitioner that had, this experience and created this positive impact in the community. But I did that by supporting and strengthening nonprofits to become more efficient and effective. So my main work has been with nonprofits as well as governments, different forms of government to work on wicked problems. So I've worked with a variety of nonprofits and government to work on environments, education, healthcare, safety, youth, domestic violence, and poverty. Played a whole bunch of different roles within nonprofits and in the community, but really my life goal is to make an impact in my community, no matter how corny that sounds. So how did I get there? My background is I have a bachelor's degree in social work from the University of Iowa, go Hawkeyes. And during my time there, I was a collegiate swimmer. So I actually swam for 17 years. That's why I have such big shoulders. And, that experience really taught me a whole lot. A big thing is working with a team, which so many of us do, but, working with 40 other women that have all different motivations, all different goals, all different challenges, really gave me the abilities I needed to work with all different people from all different backgrounds. It also gave me that sense of competitiveness, which is good in some environments, not all, but in some. Another pivotal experience in my earlier career was doing some hurricane restoration work. So I had the opportunity to go to Louisiana and Mississippi after hurricanes Katrina and Rita. And it gave me experience doing community organizing. It was really awful to see people at their worst and see the community failing them. But it was this wonderful opportunity to go to door, meet people, find out what they needed and what the community could do to rally and support them. I was able to get my master's and my PhD from the University of Wisconsin-Madison. And while I was there, I worked at the Arboretum for 4.5 years. And some of you may know the Arboretum, some of you may not, but basically it's 1,200 acres in the middle of the city. It's run by the university, but the main clientele is the community. So that was my first experience with campus community partnerships and kind of all the struggles and all the disconnect, but also the opportunities that when you're able to bring those two teams together, the greatness that you can create. So when I finished my education and graduated, I started my own consulting gig, mostly because I had some really incredible mentors that had offered this as kind of a career option for me. And I said, what the heck am I going to do? And they said, focus on the things that you're good at. But the things that I ended up doing is nonprofit management transitions. So when an executive director leaves and the board says, we don't know who to hire, the staff is in disarray, I help them with those transitions. I also help with fund development, or how I like to call fundraising, and nonprofit event planning. So that's probably the biggest reason why I'm hired, because people need money. So helping them create development programs within their own organizations. Nonprofit program management, and this is the thing probably most closely related to campus community partnerships. So I do a lot of strategic planning as well as program evaluation. But the biggest thing that I do is a lot of community research through this. So thinking about a wicked problem in the community and gaining research from it, gaining data so that we can come up with a solution on how to address it. And finally, I do training for board and staff, and then also have taught at 2 state universities within Wisconsin. And it was kind of fun preparing for this presentation where I was looking at my clientele, clients from the past 9 years. My business has been in for 9 years. And it was interesting because the projects that I've been most passionate about have been these collective impact models. So projects that I'm working on with a number of partners from various sectors to tackle a wicked problem. So most of them have been around poverty, but I've also worked on housing instability, fall research for older adults. And now my focus is mostly on substance use or overdose fatalities, which I'll talk a lot about towards the end. So how I got here, now that you know a little bit about my background, I want to go into my dissertation research. So I continue to do boundary spanning work. My husband always teases me and says, hey, you never did anything with that research, but you're still a boundary spanner. And I tell him that I do it on a daily basis, that I'm using what I learned from those studies so that I can position myself better, but also educate and mentor others so that they feel supported in the work that they do. So the focus of my dissertation, this boundary spanning in higher education, how universities can enable success, it was based on academic and extension boundary spanners that lead the charge of spanning the boundaries between university and community. So some of you are probably saying, what the heck is boundary spanning? Well, the reason you probably haven't heard of it is because it was predominantly a business and marketing tool rather than a social science term. So they used it to describe the connection between the external constituents and the internal organization. In social science research, boundary spanning is that term to describe individuals within an innovation system who have or adopt the role of linking the organization's networks with external sources of information. So Jennifer, speak English, right? So it's those people that have their legs in each sector, one in the community that are advocating for what the community members need, being really engaged with them, building these relationships, but being within the university, whether staff or faculty, and kind of this stress of being in both worlds and not feeling appreciated. So how did I even get there? Well, I wrote my master's thesis on students' interest in nonprofit careers. I had always wanted to work in the nonprofit sector growing up, but had never heard about others kind of having this similar dream or wanting to be on this career path. So I wanted to conduct a research project to see if students were interested in those types of positions, or if they even knew that was an option for them. As part of that research, I conducted a focus group of local nonprofit executives and had asked them about their own career paths and their own current positions. And yet they kept coming back to the university and community relationship, which I found fascinating. I consistently heard, we live in this incredibly rich city of knowledge, yet we don't have access to it. And so while I held on to this idea for a while, it was again in 2010 when I was writing my dissertation that I really became interested in studying campus community partnerships and how the university can work better with the community. When I was working at the Arboretum, I was part of this really great group called Community Partnerships and Outreach Staff Network, or the CPO Staff Network. And they were established in 2008 to really kind of implement the Wisconsin idea, which for those that are not from Wisconsin, which are probably the most of you, it's this idea of bringing the education to the boundaries of the state, outside of the institution, and really connecting with the community. So I attended regular meetings with this group. And when I was working at the Arboretum, it made sense because I was in that staff role. But I became more and more interested and observed the staff when I was there because they were doing so much within the universities, yet they weren't acknowledged for their work. They didn't feel appreciated. And so that's really why I wanted to do this research project, to kind of figure out how to support them, and knowing that this role was so integral to the work of the university. So what exactly is a boundary spanner? Well, this is the definition that we came up for the research project so that staff could identify. They could say, yep, I'm a boundary spanner, or no, I have no idea what that means. So the definition was, I either work for the university or extension in roles distinct from tenure-track faculty that work between the university and the community to represent the needs of both parties, connecting the university or the community college resources with community needs, communication, that being huge, translating the communication between them, engaging the community as a representative of the institution, striving to create that mutually beneficial partnership. So I love this too, because it was basically saying, we want to bring the community to the table because their voice is so important and we're going to advocate for them. So what did the research project look like? So I was able to get a hold of 3 different universities. A whole bunch of staff had done some surveys, had done some focus groups, but the main questions that I had were, how can universities better support boundary spanners? So I knew this role was so important to the work of universities and community engagement, but how are they supporting them? The other thing that I wanted to know was, what was the difference between university staff or academic staff and extension staff? So I was able to look at 3 different universities, which I mentioned, and I'm not a creative person. So it was Northern University, Southern University, and Midwestern University. Looking at those 3 universities that had the 2 different groups of staff, we had the university staff and the extension staff. And I had a total of 832 people that were able to finish the survey and had qualified as a boundary spanner. And what I found was interesting, and I will just make this kind of asterisk. So I did this research 10 years ago, and I know for one of the universities that things have changed greatly. I also know that, during the pandemic, it affected so much of what we do and our work with the community. The community has changed. So it would be interesting to do a follow-up study to see if these still exist, these findings still exist, and also what additional support is needed. In terms of identities, because that was a big question, is beyond that definition of boundary spanning, what is part of their job? So extension staff had been in their positions longer, had been at their current institutions longer. They spent a larger portion of their job on boundary spanning work. On average, they were more likely to have community partnership and outreach activities as part of their job. So not just as duties as assigned, as one of those separate things with your job responsibilities. They worked most regularly with, a lot of those community partners that we all work with. Academic staff, as compared to extension staff, had a higher degree or level of school completed than extension staff. When I asked about the functions or the roles that they did, it was interesting because those extension staff really, had the relate, cultivate, all those pieces. But the main 3 parts of their job that they saw as the priorities in their work were to relate. So we define that as bringing people together or understanding their interests and gathering information. To communicate, I had mentioned that earlier in the definition about how communications, between universities and communities is so important, and translation of what's going on, as well as educating. And that could be learning or applying or disseminating. So taking research from the university and making it applicable to the community. All those were seen as functions of extension staff. But then it really got into how they felt. And, these were the highest scores for each. And academic staff felt a little bit visible from their supervisors and colleagues, and solidarity with, once again, the people that are in their office. But extension staff felt visible, supported, valued, solidarity with their colleagues, and resources. They had so many more resources available to them. So professional development opportunities or rewards, the outstanding, community partner, they were able to get those. And so it was really incredible that the extension staff felt so much more supported than the academic staff did. Looking at the difference between the 3 universities, Southern University was much stronger than the rest in terms of boundary spanners and supporting them. And it was interesting because when I was able to dig in further about why that was, it really was because they had this department that was focused on boundary spanning. They had this Journal of Higher Education and Outreach and Engagement. So they were doing research. But the other reason was that Southern University was very unique. It had already taken the steps to be more supportive of boundary spanning staff. They saw the boundary spanning staff as such a huge asset to the work that they do. that they were supported in different ways than the other universities did. So I really thought about those as I was offering implications or suggestions for universities on what they should do, because that really was my goal, was to figure out how better to support the staff, but also make sure that universities knew what to do. And for those that are not in campus community partnerships, I think this is applicable to any agency that you work with, any organization, in thinking about how you support those staff that might have their legs in two different sectors, right? That might be struggling to advocate for two different, kinds of groups. So think about that as we're going through these. And like I said, I'm not a creative person. So, the 5 recommendations I had were to see it, value it, support it, fund it, and change it. I really liked the exclamation points too. In terms of seeing it, so institutions need to recognize and see the hard work of boundary spanning staff. I think we can all agree to that. As one staff member had said, I would very much like to be recognized and appreciated by upper administration for the work I accomplish, work that is often that of higher educated, higher paid individuals. I do not necessarily want public recognition, but rather to know that those in higher administration outside of my office are aware of my work habits, my capabilities, and my knowledge. I think about that all the time with the work that I do, of how am I recognizing and showing appreciation to my community partners that I'm working with, knowing that strengthens the partnership, but also encourages them to keep working hard. Value it. Essentially, this suggestion means valuing the importance of people working together. So as one staff member pointed out, the institution should realize that we're stretched pretty thin and operation is becoming anorexic versus lean and mean. I'm sure we all understand that now as we've continued to get funding cuts and less resources. But remember that working together can help us meet our goals and be more effective and more efficient in lean times. Support it. Another offered the idea, one of the participants who had followed up with the survey, create more incentives for personal reward for translating research to practice. Incentives and rewards may be a good alternative to supporting staff if additional funding for salaries is not available. I wish that everyone could get paid millions of dollars for the work that they do. Unfortunately, we don't have those budgets. But in my work with community partnerships, I'm always thinking about how I can support others. And sometimes it's through grant funding, finding a project that they're working on to get additional funds. Sometimes it's nominating them for an award. Sometimes it's just giving them more time, realizing that they have so much going on. So figuring out, once again, how you can support your partners so that they can continue to be strong in their work. And then fund it. Obviously, I said it before that I wish we could, fund everyone and give everyone millions of dollars to do the work that they love. But this 4th suggestion is to evaluate the resources currently available to boundary spanners to see if they're adequate for the work that they do and the results that the university wants. Many staff said, I do not feel the university truly understands the important role of academic staff in outreach or provides adequate resources for outreach staff. Every time I read that, I get so sad thinking about, staff that are working this, that don't feel that appreciation. So thinking about, once again, how can we continue to fund these projects? And I think, grants are a great way. I think awards are great. And once again, if you have the budgets, making sure to increase, the support, financial support for those staff because they're doing such outstanding work. Lastly, change it. And this is, kind of something on all of us. It wasn't just for the universities, but the final suggestion was to change it, meaning to change our attitude, which may be the most difficult of all the suggestions. But as stated by other researchers, this is the time of innovation. And I think we've especially experienced that during the pandemic, right? To continue the inspiring work we do on a regular basis, we need to change our attitude so that what we do now is the foundation for what we do many years to come. Being a boundary spanner means adapting and evolving as the community around you does. Once again, just like we've done during this pandemic. As one staff member said, I believe the specialist position by nature is one that is initially utilized to fill an immediate need or priority. As time evolves, so too should the nature of that specialist position. So a critical function at any university, changing our attitude is directed at all stakeholders involved in boundary spanning. So I'm going to finish this research part on this woman. And if you know this woman, can you write it in the chat? Does anyone know who this is? So her name is Catherine Kramer, and she is one of my mentors and colleagues and inspirations. She's just incredible. She's a professor at University of Wisconsin-Madison, and she was in political science and journalism, and she was the director of the Morgridge Center for Public Service. So she'd done all this amazing community research and community work, mostly on service learning and civic responsibility. But specifically in this book, she shared lessons from her conversations with rural communities in Wisconsin. Rural voters often felt forgotten or misunderstood and disrespected, which directly affects their sense of politics and whom they elect to office. So very much, a lot of the populations that we're working with, right? They feel forgotten, misunderstood, and disrespected. So beyond politics, this is why I bring this up. For a year, she went to gas stations, bars, churches, neighborhood centers, and basically any local hangout that she could to find people gathering together. They would discuss local news and create a supportive environment to talk. And Catherine just listened, observed, and wrote. So even though Catherine is a faculty member and the definition for a boundary spanner was not a tenured track faculty member, I do believe that she is a boundary spanner. And it probably reflects what many of you already do. She consistently goes beyond her institution and works in the community to address issues. While it would be great to have the support of the university, it's not always possible. And yet we have to keep advocating for community members if we want to create community change. And I think she was just so brilliant in thinking about how to build those relationships and how to gain that feedback. So I encourage everyone to think about boundary spanning in that way. I'm just going to take a quick pause and ask if there are any questions. Okay, if you have more questions, go ahead and type them in the chat. Okay, so what is the broader application? I'm going to move the chat box there. So how do we create that community change as part of campus community partnerships? So I love this. I was looking for, an image to have to describe campus community partnerships. And when I saw this, I almost laughed out loud. And I apologize if any of you created this beautiful vision. But to me, this is like much too clean for what real campus community partnerships look like. Instead, there's this one, and I love this. It's messy. It has a lot of questions. It's making sure you're focused on building relationships and lifting up equity concerns, making sure everyone has a voice. And I love this at the top right, there's the anchor. It says, vision universities as anchors in community. Think about that. Having it be a partner rather than a place. So yes, Juliana, I love it. That's exactly my brain, except it's like a little bit even messier too. I also love this quote from Coretta Scott King, because many times for me, it reminds me that when I'm working to create a strong community, I have to find people's compassion. And that's when action occurs. And I have two stories about this. And I'm sure you all have stories of this too, when you're able to capture someone's compassion. And that's really when something moves in the community. So the first one was, in a previous job, I was having meetings regularly, and one of my older colleagues, she would consistently throw up her hands and barriers for why we couldn't do things. She'd say, well, we tried it once, so we can't ever do it again. Or, she would have irrational reasons why we couldn't do something, and it would just take things forever. And so I finally sat down with her and to get to know her, ask her a little bit more about her and her history. And I learned that she was so afraid of being irrelevant. She thought that she had nothing to offer other than these barriers. So from that point on, when I was running meetings, I decided we would have this kind of cool historical check, right? So we would, be talking about benches. This was at the Arboretum. We would be talking about benches, and I would ask the woman, hey, can you share the historical perspective of, what benches were like in the past, what we did as a program, what worked, what didn't, and then we'd move on. And it was like something shifted in her, right? It was incredible, because when I gave her the opportunity to be heard, she'd share her experience, and then we'd all be able to shift, right? She was open to change. And that was one, she became really excited to be part of it then. My other example is from a partner that I work with now. So this person had been involved with, a project for about 2 years, was always throwing up walls, seeming upset at meetings, was getting really defensive and really unproductive with what we were trying to do. I'd meet with him regularly to check in, have phone calls, really not excited about the phone calls, just to see how things were going. And usually they were always critical and negative and always about issues we needed to work on from his point of view. And then he opened up. So 2 years into our relationship, and I knew something had to be up because he kept showing up, even though he was being a pain in the butt. But he opened up and he told me that he had a personal story with what we were doing. And when he was able to open up there, once again, kind of like my other colleague, something opened up, something that he wouldn't share with others. I had taken the time to build the trust with him, and he knew that I was compassionate about it, and he was too. And at that point, everything changed and he became open to new ideas. We began working on recommendations to make sure that work was happening. And I guess my advice with this is realize that just because someone doesn't move mountains now doesn't mean that they won't in the future. And that really applies to the campus community partnerships. While not a campus community partnership, I want to talk about that broader application, and that's through overdose fatality reviews. I'm not sure if you all know what an overdose fatality review is or not. I know that there are roughly 17 OFRs. I did my own research. Jefferson County, I think, is getting one started, but the rest of the counties have one. But these OFRs have the same discord and conflicts that campus community partnerships have. There's power differentials, communication issues, broken systems, lack of engagement, lack of leadership, not enough resources. Do I really need to go on? Or I'm sure you guys all have your list. But overdose fatality review teams are designed to increase that cross-system collaboration among public safety, public health, social service agencies to identify missed opportunities and system gaps and develop recommendations for intervention efforts in hopes to preventing future overdose deaths. The primary purpose, like I said, is to prevent overdose deaths. And we do this by looking at those gaps that people fall through, look at root causes of substance use disorder, look at prevention opportunities, as well as identifying and creating recommendations for change that go beyond policies, and look how we can create new programs or expand programs that are already working, doing good things to address the needs of those struggling. Finally, and this is probably the most important and most related to campus community partnerships, building that collaboration and building that community among partners from all sectors. I've had the amazing opportunity to facilitate and run the overdose fatality review team in Winnebago County, Wisconsin, where I live, population around 172,000. I've run other fatality reviews and also serve as a national consultant to get OFRs running, but I know this team the best, and so I'm going to use it as the example. A little background on our OFR team is that we started in 2018. And it was developed by a prevention coalition, our Drug and Alcohol Coalition. It was funded by DOJ and DHS. And while we assist teams both nationally and throughout the state, I think what's most impressive is our team list. I'm sure you all have big teams in what you're doing with community partners. And it may look similar to this too. Our OFR team is a multi-sector team, including the coalition, law enforcement at all levels, healthcare, public health, human services, child welfare, treatment, recovery, education, and faith communities. We have 47 partners representing 36 agencies, and I usually have about 30 people show up on a monthly basis for our team meeting. It is a big and committed team. It's also really exciting. I think this is a little bit cleaner than the diagram of the campus community partnerships, but I'm sure it's still overwhelming. I find it overwhelming. Basically, we have a huge team of partners and set priorities every year on what we need to do. So, with this one, we talk about child trauma, mental health, referral to care, prevention and harm reduction, recovery support, communication and engagement, social connectedness, and then we also do partner support and TA as part of our job. From there, all those ovals on the bottom, those are all committees that I have for every recommendation we're working on. And they're filled with not only our OFR partners, which I've already talked about, but other community members that care about what we're doing. So we're constantly working across sector to do our work. And we have a lot of engaged partners doing amazing work to try and prevent overdose deaths. Here's some examples of the work that we're trying to do. We have a Handle with Care program that we started that some of you may have in your communities. Basically, it's a national program that our local police department notifies school social workers when they've come into contact with kids within the last 24 hours. So it could be for a burglary, domestic violence, homicide, overdose. And basically, the social workers assess for trauma, knowing that even sometimes if kids see a police officer, they might have extreme trauma. So they assess that trauma to make sure that the kid is taken care of. We're doing an intervention pilot for children whose wellness is called into Child Protective Services and doesn't reach the level of intervention. Instead, we've partnered with our local Boys and Girls Club, who will now provide outreach to those families, advertising free childcare or food or tutoring help, as well as meeting basic needs. We're partnering with law enforcement, child protective services, and local hospitals to support drug-endangered children to make sure they're taken out of homes when necessary and get proper medical attention to keep them safe. We're also getting a rapid response program up, which once again, these are probably programs that you have in your own community. And that rapid response program is going to be led by people in recovery, connecting to people struggling with substance use disorder at every level in our community. So it could be picking someone up from jail after they've been released, or connecting with people who've been kicked out of treatment. It could be family members that are worried about someone and connecting them to that rapid response program. Basically, we're trying to get people peer support and access to help when they need it most. The other pilots that are listed here are collaborations with public health, human services, law enforcement, EMS, people in recovery. We're working on a spike alert system when there's a large number of overdoses. We're trying to get as much Narcan out into the community as much as possible. And we're also connecting with people that are struggling with housing stability on top of all of it. All of our programs and recommendations, and this is a list of some of the recommendations and ideas, involve a lot of partners from various sectors working together to create change in our community and hopefully to save lives. And it's not perfect. I want to be clear about that. And in most cases, it takes a lot of time. But I want to focus on one initiative in general that shows how working across sectors truly made a change in our community. And that's this. So this was one of our projects that a colleague of mine, she and I did 13 community conversations with people in recovery. It was around social connectedness, but specific to how people in recovery felt about their relationships, having a sense of belonging and having a meaningful contribution to their community. What we heard was that people in recovery wanted to feel valued and heard from the community. They wanted to bridge the recovery community, which is really strong, with the broader community to let them know what was going on. They talked a lot about personal experience and wanting the community, as well as their family and friends, to know that addiction is a disease, not a moral or value failure. And finally, they kept talking about the stigma and shame that they feel on a daily basis, whether it's struggling in active addiction to beyond while they were in recovery. Anything we could do would be much appreciated. So one conversation in particular inspired this conference, which we had 2 weeks ago. Two women who were young and new to recovery said, wouldn't it be amazing if we threw this great community events to show that we care, that we brought everyone in the community together to celebrate recovery, get rid of stigma, and by doing so, maybe save some lives. And we made it happen. It was going to be last September, but we postponed it due to COVID to March 30th, so 2 weeks ago. And we brought in a national keynote speaker, Lauren Sisler, who could share her personal story of losing both her parents to overdose addiction. And she truly was incredible. We kept the message of we heart you, which means we care and want people to get the help they need, which was actually inspired by this guy. This is Captain Chris Tarman at the University of Wisconsin Oshkosh Police Department, who at an OFR meeting said, wouldn't it be great if I could go beyond my uniform and I could tell people that I want to get them help and that I genuinely care about them? Or just say, we heart you, and maybe they would take that. So we created this resource card, which I don't have, usually I show right away, but and out of that recommendation, it was anyone that, you come into contact that's struggling with substance use disorder or can use some help, that you would give them this card that says, we heart you, and it has United Way's 211 number on the back to get help. We figured that, most people when we're receiving this card might throw out the first 5, maybe the 7, maybe the 9, but maybe on the 10th card when they got it from, the 10th person, and they'd see that same message and hear that same consistent message in the community, then maybe they would get the help. So we kept that idea of we heart you for this event. And the room was filled with all walks of life, all different stories. We had people in recovery, people who had lost loved ones to overdoses and substance use, people leading community change through coalition work. We had people struggling with mental health that knew that stigma and shame of substance use disorder who wanted to be heard as well. We ended up having 333 people attend the events. And we had people in recovery constantly throughout the day ground the community with their personal stories. We also had practitioners sharing their expertise through breakout sessions because we wanted to highlight local resources. This is a group of my colleagues at Public Health, and they were a major funding partner, as well as had additional local sponsors to help fund the events. And this is probably my favorite part, but we even had a snuggle booth with Griffin, the therapy dog, which was a huge hit. Honestly, a golden doodle in an event of 333, he was a huge hit and people just adored him. But it was the fact that people showed up in person. Oh, it was amazing to be in person, to have people in recovery that felt acknowledged and valued and heard. And we heard stories of inspiration, grief, and success. We heard stories about lives that were cut too short that we paid tribute to. But our goal was to change our community and be a community that welcomes second, third, fourth plus chances, reaching out to those that are most vulnerable, whose society has basically written off, and those that have been sick and struggling with a disease called addiction. Together, we became a community that cared. And I'm so grateful that I could be a part of it. The ripples have definitely started from this event, and we know that they're going to continue. Actually, tonight we're having a premiere of our recap video, which I'm going to show you in a little bit. But I'm so excited to see what happens a year from now, knowing that this was the start of something much bigger. But how was this all possible? So here are your tips and tricks. As I said, I'm a facilitator for a lot of these projects. And this is something that, when you're working on a campus community partnership, that you can use these same techniques. So remember that a well-facilitated meeting and projects can really help build those relationships and create that community change. So here are some tips. So create a safe, welcoming, and inclusive environment before everyone gets to the meeting, during, and after. It's really important to think about that environment as conducive for networking, side conversations, which aren't always bad. Sometimes the best things happen in those side conversations. Welcoming new members, especially people of color or other marginalized communities that might be coming to your meeting. Think about the room arrangements. So think about, are the tables facing each other, and make sure there are no outlying tables, because if those are out there, they're going to be excluded from the conversation, and also they just won't participate. I have a lot of law enforcement that always like to go to those tables, and I push them in. Think about food or coffee, also name tags, so you're not like me and feel silly when you ask someone their name for the 10th time. This next one is a rule for OFRs, and I wish that campus community partnerships could do the same, because I think it's so powerful. So we don't use any titles. We just use first names. And we talk about how, while we appreciate everyone's background and education and title, that using people's first name creates a sense of equality to the people in the room. By removing those titles, we allow for everyone to be viewed as peers, and therefore all thoughts, opinions, and recommendations carry the same importance and credibility. I just love that. The other thing that I have is I have group reminders. I don't call them ground rules because I don't want people to think I'm too demanding. But every meeting I start with these group reminders. And the one that I like best, so it's the little PowerPoint on the right side, is we're here to improve the work we do and save lives. So for me, and not everyone's work is to try and save lives, it could be something else, but I talk about accountability for our own actions and our own organizations, not accusing others or not blaming others for why the problem exists, but be solutions-based, and also think that changes can happen at every level within an organization. I also introduce person-first language to the team at every meeting. So no matter your cause, it's important to use person-first language to show respect to all individuals and communicate it in a way that puts personhood before labels. In my work, I have a lot of people with lived experience around the table. I want to make sure that they feel respected and that they feel comfortable and welcome in this space. Thus, I educate the team on a regular basis to make sure to use proper language. I ask reflective questions and clarifying questions. So I like to say, as the facilitator, that I get to ask all the dumb questions, and I use self-deprecating humor in my facilitation. But I also know that you can't assume that everyone has the same understanding or knows the same material. I like to ask questions in this manner to make sure that we're all on the same page, especially since everyone's got varying life experiences and knowledge. Body language says a lot. And I feel like, webinar, this is not really conducive to it. But when you're in a room or even with Zoom using videos, making sure that you pay attention to that nonverbal communication and following up with people or calling people out if they're responding in a way that says, I'm disengaged or I disagree, making sure to call them in. Get comfortable and lean into silence. So I love this because I'm a talker and silence is sometimes uncomfortable, but I once had this professor he was a community organizer, and he would sit the entire class without saying a word if people didn't respond to his question. And I think about that all the time, realizing that if I create space for people to share, they will talk. Sometimes you have to do probing questions, but sometimes you just have to sit, knowing that people take a while to process. Meet people where they are and do not force an agenda. So I work with people from all different walks of life, all different backgrounds, as I'm sure you all do. So realize that it takes time for them to change and meet where they're at, offer support and training for what they need, but also don't force your agenda. Try and understand where they're coming from so that you can grow together. These are your tips and tricks for engaging community partners. So beyond facilitating meetings, but tailoring the process to your community. So often our projects are funded by grants that tell us a specific process we have to use. And I'm not telling you to not use that, but rather relate it to your community. It's kind of like when my mom, came to visit me when I had my first child, and she said, your child, your best, teach others how to deal with her. And I'm still teaching others how to deal with her. But think about it in that same way. Is there a slogan that your community uses? Are there values to it? Is there a special place that your community meets or treasures or, different food? Making sure that is all part of the process. Have a coffee date. So, there's research out there saying you do 5 or 10 or 100 cups of coffee. And you know what? As a coffee drinker, I'm in support of all of that. But as an agent of change, whether you're staff or faculty or a facilitator or a partner, taking that time to meet people one-on-one to truly get to know them. Similar to what I had talked about with the previous job, in getting to know her and figuring out why she was causing some of these challenges and how we could get past it. It's also really helped me with that final point that says get personal, which I'll talk about in a little bit. Breaking the ice. So I already did this with you all with the over and under, and I hate icebreakers. I want to be very clear. I hate icebreakers, and this has become our signature tool. And that's because I had 3 OFRs and nobody said a single word. And so I stood up there and I said, what do I have to do to make you all talk? And it was probably rude and way too direct. And the chief of police said to me, I don't want to look stupid. And I go, oh, I can make you all look stupid. That's okay. So we use an icebreaker every time. And it's partly because I want everyone to warm up their voice and practice talking, right? And also they may not say a single thing the rest of the meeting. So at least they've said one thing. But it also allows the partners to get to know each other and also to have a little bit of fun, especially when we're doing such heartbreaking work. If you need ideas, I have plenty. Just let me know. Dropping the jargon. So in the group reminders, maybe some of you saw, but I use the term acronym. So when someone says an acronym in the meeting, I go like this, and that's an acronym. And the person has to explain the acronym. And that's because jargon can be extremely divisive. I said that I have 36 agencies represented with 10 different sectors. They all have a different language. And I want to make sure that we're all on the same page, which goes into the next one. To make sure that partners make this work a priority, the process has to be relevant. So I spend a lot of time connecting with partners. So I meet them, I call them, I email them, I talk with them, and I'm constantly getting feedback and changing the process based on it. And it really is getting on that same page to make sure that I know what they need and they know what I need. Finding your champions. So I think a lot of times this work can feel lonely and daunting as well. It's really looking at who are your champions that are excited about your work, that are going to support what you do, or who may already be creating those changes. And what I found is when I support them and we work on what they're doing, we have a little bit of success and more partners come. So find the people that can help make the work move forward. Lastly, get personal. And not everyone's going to feel comfortable with doing this, but I send flowers when someone has surgery or someone's lost a loved one. I have gotten to know all my partners' favorite candy so that I can randomly send a little card with their candy. I will tell you that, as you all know, and some of you have probably been this person, a lot of people around the table are voluntold to be there. I want to make sure that I am appreciating their time and making the most of it. And I want everyone to make sure that they feel appreciated. So getting personal and getting to know what makes them tick, what makes them excited really is an investment that will pay off. So this next slide that I'm going to show you, okay, good, it's not going to start. So this is how this event became a success. From all the meetings that we were, facilitated in the way that I've talked about, all the relationship building that I had done became this. So I hope that you're willing. I'm having the premiere tonight, but I feel like you all could have the feeling of how the event felt. So here you go. Oh, second try.
We fall down time and time and time again, but we got to get back up. We got to keep moving forward at all costs. And we got to celebrate. We got to celebrate life's victories, no victory too big or small. But we also need to celebrate the failures, because those failures, if we create space in our hearts for those failures, that is the catalyst. Everyone has been through the challenges, the disappointments, the ups and downs, oh man, I made a major mistake there. I wish I could take that one back. We have all been there, but we all have a story that is uniquely beautiful and is uniquely you. People, every single day, they are shaped by something in their life. We are here in a community. We are here in a community that is filled with hope. We are here in a community that wants to inspire, that wants to encourage, and that ultimately wants to provide each and every one of you with unconditional love. You all made a choice, as I said from the beginning, to be in this room today. You all have a story. Every single person in this room has a story. I want to encourage each and every one of you to fall in love with your story. By all means, fall in love with your story and keep moving forward no matter what it is that you've been through.
These are painful stories and inspirational stories, and I thank you, I thank you, I thank you. And I love the slogan here. It is, we heart you. And absolutely, we heart you, we heart you, we heart you. Thank you.
And I think that we have to look at this event, the first ever We Heart You event. And I think the one thing that I take from this is love. Unconditional love.
So I always get emotional about it, because that is community, and it took so much work, so much sweat, so much tears, and so much joy, and so many wonderful people together. And I think that when you're working on these campus community partnerships, thinking about how you can have those champions, how you can build those relationships and continue to build community like this. I hope through this presentation, you were able to learn a little bit about boundary spanning, a little bit about overdose fatality reviews, really being that example or that broader application of campus community partnerships, as well as some tips and tricks. And I guess this is my last piece of advice for you. So be a boundary spanner that creates community change, whether that's through campus community partnerships or in your community in another role. And do it by listening. We talk too much and don't listen and observe what's around us. I've learned so much by just listening and taking the time and being intentional, whether it was with the community conversations with people in recovery, or I've done this with, people and older adults in falls. Being intentional and taking the time to listen. I always think about Catherine Kramer, who I mentioned, and that professor, who took the time and went to all the different spaces to listen and to learn. Be genuine and authentic. So, I've been called real many times, and I don't know if that's a compliment or not. Maybe it's because I'm direct. Maybe it's because I've got so much energy, but I like to say it's because I build relationships with people. And when I'm genuine, they return with authenticity. And it's through those real relationships that change has happened. Have patience, but also fight when you need to. So change takes time, and some say at the speed of trust. Since change doesn't happen overnight, you need to have some patience with others, but also with yourself. And that's one thing I'm not good at. At the same time, fight and advocate when you need to. I regularly talk about how people's lives are at stake with what we're trying to do. We have seen a huge increase of overdose deaths in the last 2 years, and they're only getting worse. If we don't do something about it now, it will continue to get worse. And that's when I give up my patience, and that's when I fight with urgency. And lastly, and most importantly, and hopefully some of you are chuckling, don't take yourself too seriously. Community work can be really hard, but it can also really be fun if you let yourself have the opportunity. So now I'm going to stop sharing. And if you have questions, I would be more than happy to answer them. Who's going to be a brave soul?
There's got to be this is beautiful, very moving, Marissa says. Yeah.
Thank you, Marissa.
I did put in the chat that if you would like to verbally ask your question, you can just raise your hand. Ashley would love to unmute you, and we would love to hear your voices.
Such a quiet group. I hope I didn't put everyone to sleep.
Jennifer, I just want to point out that though, you use the example of your passion of overdose and, that whole realm around opioids and drug misuse and stuff. Basically what you have laid out though is so transferable to the work that we do, no matter what. And you said the term wicked problem, no matter what the wicked problem is.
Yeah. Yeah. And I would just say it's interesting because I got involved with OFRs because I didn't have any background in substance use. So I'd never worked with any of those partners, but it was my work with community organizations and community impact models. And so they wanted someone that was able to build multi-sector relationships, and that's how I did it. So Kim, your question is about faith-based sector. So with our OFR, the faith community is actually really involved. And when I worked with the Poverty Collective Impact, it was as well. And, a couple things that we've done. So specifically with OFR, I have 2 faith leaders around the table. And I love having them there because they have such a different perspective and they ask questions that, for example, my law enforcement or my public health partners wouldn't ask. So it's really important to have the voice. But one thing that we did was we actually had one recommendation, creating a faith guide for them so that knowing that faith leaders might be the first point of contact for people struggling with substance use disorder. So how can that faith leader feel confident and know where to turn? So we worked with a lot of faith leaders in the community to, figure out what resources that they knew and created something that would be helpful for them. Thank you for the question. See, I don't bite. Any other questions?
They're all formulating.
Yeah, I know. That's right. I'm supposed to lean in the silence. I should let myself do that.
Oh, there's something in the chat.
Okay, let's see if I can. This was very validating. I didn't know the term boundary spanning, but that is what I do as a prevention professional. I'm constantly saying that our campus boundaries are not concrete. Yep. Our students are a part of the community. I also love the saying that, oh no, sorry, I'm bad with chat. There we go. I also love the saying that change takes time, but at the speed of trust. Yeah, and it's interesting. Thank you so much for your comment, Michelle. In every collective impact model that I've worked with, everyone uses that quote of, it takes the speed of trust. And, it could be my social worker background, but I really have found it to be helpful building those one-on-one relationships. Because then when I built the trust with that person, I know how to push them or motivate them or support them when we're in a bigger group. Because I think so often when we're in a big group, and like I said, I'm managing 30 people at a time and trying to make sure that they all feel included and feel like they have space, to share. it's really hard in that setting. And that's why, building that trust outside of the room is even more important than doing the entire group.
After speaking with you, Jennifer, it was the first time too that I heard the term boundary spanning, but I love it because it does explain a lot of prevention work, no matter, what your area of expertise is.
I think, it's kind of like when you get a diagnosis, sometimes then you have like ownership of it, right? Of like why you're having these struggles. And I think for the staff I worked with, that really was something they were able to hold on to. Like, yep, I have all this power because I'm a boundary spanner. Oh, but there's all these other issues that are outside of my control that I have to deal with, and all this stress back and forth, right? And so that's why I've, translated it to all the collective impact work that I've done too, is, even outside the campus community partnerships, all these institutions with a community partner really face it.
If we could see their faces, we would see them, thinking.
That's okay. Well, and I'll put in my email here too. There you go. Because I think often, if you've got a question about the program that I had mentioned, or any of the research, or about OFRs, please feel free to email me. I'm more than happy to connect you with resources. What typical challenges do you observe between community and higher ed partners, and how do you bridge them? Well, I think that communication is one. I think expectations is another. When I worked at the Arboretum, it was always fascinating to me because we'd have, like I said, this disconnect of, we'd have faculty that were in botany and horticulture that saw the Arboretum as their research space. But all the staff that worked there saw, educating youth about nature and having people do nature walks and learning about burning a prairie and all of that. And the expectations of the place were different. And so a lot of times when there was tension, it was that, the expectations were in conflict. And so, when we were able to advance things, it was, all right, let's set our expectations clear, and also make sure that our communication is clear too. So, I mentioned the jargon piece, and, universities are really good at jargon too. And when you're working with community partners, that usually has that source of conflict. I think that the other piece is titles, right? And backgrounds. So a lot of times, people in the community, depending on who you work with, but if you work with marginalized populations, if you bring your PhD, or you bring your fancy schmancy language or your resources, then it's intimidating, and immediately the walls go up. One thing that I've always tried to do with campus community partnerships is meet in the community and not at the university, because so often, especially with those marginalized populations, they may have had a bad experience with those institutions and not feel welcome. So thinking about where you go, and thinking about how you hold a meeting, the way that I dress when doing community work is very different, because I want to make sure that I'm relatable. So I think that it kind of goes along with expectations, but I think, once again, having those different titles and having those different power differentials, if you can get rid of those or create an environment that is welcoming of all, then you're more likely to be successful. You're welcome. Thank you, Laura.
I like that you mentioned space, like actual physical space of where people come together. Because I think sometimes just having either that neutrality or, knowing that if there is that, I don't want to say intimidation because that's such a strong word, but, you're meeting with people in the community and they see you in this capacity of power or title or, whatever your role is on the campus. I think, again, kind of going back to meet them where they're at, including in their own physical space. So I really like that you touch on that.
I would also say, and I don't know if everyone has the flexibility to do this, but I have a lot of night meetings because community partners can't meet during the day, so, and I have the flexibility of doing that with my own work, but I have a lot of night meetings and weekend meetings and showing up at that time because I try and make it as flexible as possible to support the community partner, right? Especially when usually they're not paid to do the work. I've had partners show up for my meetings and have to take a day off their job. So once again, just trying to find appreciation. And sometimes that appreciation is me coming to them and me, being a little bit more flexible.
I always like adding those like incentives. So, if you work in the nonprofit world, you're not in it to get for the paycheck to get rich. So, and to kind of incentivize a meeting or just coming together, I'm like, what can we provide that would make it a little more, I don't know, worth it to them? Not that the work isn't worth it, but we all like to be treated well. So, whether it's lunch or coffee or bagels and delicious cream cheese, just those little, I call them incentives, but I'm sure there's another.
I don't think I've ever had a meeting where I don't bring like food or beverage, mostly because I want it. But I think it does bring people. I mentioned the funding piece a lot. So with this event that I just had, I was able to get some sponsors, and I was able to give everyone on the planning team a $50 gift certificate to or Visa gift certificate. So. And most of them were just flabbergasted that I had done that. But the number of hours that they volunteered to help plan this event and be at the event, and $50 isn't paying their time, but the fact that I wrote it as part of the budget, and had a thank you note, like it meant the world. And so I think about that, like what are those small things? Or usually I have it with my OFR partners. I was able to get some funding, and I got one of my icebreaker questions was, what's your favorite thing to get at a conference that you'd like, elbow someone out of the way, to get your swag, right? What's your favorite swag? And everyone said a pen. And then a lot of people had said journals or notepads. And so I was able to get a little funding, and I got everyone to have a note, a journal with our new OFR logo on it and a pen. And I wrote a personalized thank you note. And I did this last fall, and I went to every one of their offices, a lot of offices, and dropped it off and said, thanks for being an OFR partner. And you know how many people showed up at the next meeting? Like 90%, because I had showed up for them and showed some appreciation. And so I think, it doesn't have to be super expensive, but there's so many simple ways to show appreciation. And honestly, like that's how you build the relationship. That's how you build the trust. And that's really, eventually where you get to the community change.
Like that. I think probably now more than ever, it's really important to have that, I don't want to say in person, but that personal touch to, because we've been kind of isolated a little bit. And I say that because something happened yesterday. We in another part of my job, we've been working with a studio to do some filming for a event that we're having. And we've been meeting with with the people at the studio for months and months now, but it's always, you just see them from the chest up and that's it. So we were in studio yesterday doing some pre-filming, and a couple of the people that didn't need to be there showed up just to say, we just wanted to meet in person and like have a conversation, just chat. And, and it was like, wow, you're so much taller than I thought,
It is, so we had our first in-person OFR at the beginning of March, and it had been 2 years that we had been, virtual. And I was amazed at how many people still stayed engaged. And there are definitely ways that you can connect with people virtually. You just have to be intentional about it. But it was our first in-person meeting, and I did speed dating. So here's another tip and trick. Okay. So they're all like, oh, they rolled their eyes at me. But we did 6 rounds of 3 minutes, and every 3 minutes I asked a new icebreaker question, and you were paired up with a partner. And it was because I had about 10 new partners from the beginning of the pandemic that had never met people in person. So it was 18 minutes total. And oh my gosh, they didn't stop talking. It was incredible. Like, they were so happy to see each other and so happy to connect. And it was like that meeting ran so smooth because they were reconnected. So I think also as we continue to, get through this pandemic and you're able to meet with your partners in person, take some time, even though, you've got plenty on your agenda to do, take some time and be intentional of letting people connect. And even though it may stress you out, like it does me sometimes, that we have so much to get done, just pause and celebrate that you're together. Because once again, it will truly benefit your work.
It's very technical stuff.
It is. It is. Any other questions? Did you guys like my video, my recap video? Thank you, Kim. Oh, hooray. Did it make anyone cry? Because it makes me cry every time, but it was, and the coolest part about that video was the guy who created it. He's a person in recovery, and he's worked on a few projects with us, but I didn't hire him for the event. And he just said, hey, can I come and film? I feel the need to do that. And that's what he created. So I owe him a big cookie basket or something to say thank you, because
it was very well done.
Yeah.
It captured all the feels.
Yeah, all the feels. Good. Well, as I said, I sent you my email. I put that in the chat. So if you have any follow-up questions, feel free to email me. I'm always happy to talk to other people.
Jennifer, if you had one takeaway or one major thing that you would want to leave everybody with today after this webinar, what would it be?
Yeah. I think it's to be real. I know that sounds so, corny and childish at points, but the keynote that was there. So that was part of her speech, and she was incredible. If you're looking for a speaker, Lauren Sisler, she was incredible. But she and I had a long talk about why her story is so inspiring and so successful, and why so many good things have happened in our community. And I'd say it's because we're real and genuine and authentic. And I think when you are able to portray that in yourself, community partners, university, staff and faculty also kind of feed into that. And then I think, like I said, that's really when you make change, is when you're able to have that genuine relationship with people.
I have to say that takes practice, I think. Moving a little bit outside of your professional, your own internalized professional requirements, and, kind of saying, all right, I am a professional, but I'm also human.
And I don't think you need to air all your dirty secrets. Don't get me wrong. It's not, you don't need to know everything about me, but I think that when you build relationships and you get to know people, I mentioned the, getting personal at the last point, and, the number of people that I followed up with partners of flowers when they've lost someone or, had surgery. I'm not doing it to benefit the community and change, it's just part of who I am, but it has done that because we've been real with each other and realized that life is, the bigger thing. Work is just a part of it. Right. And I think when you can realize that everyone is a person, then we're able to work better.
I completely agree.
Well, thank you so much for this opportunity.
Absolutely. Thank you for coming and speaking to our audience and for the content, including the realness of it. And I enjoy the energy that you bring to this. It's refreshing.
Good. Thank you.
Oh, and Ashley has put the evaluation link in the chat. And the link for the next and final Rise and Thrive webinar, and at least in phase 1. And we'll be talking about sustainability and what that looks like as far as financially, as far as faculty well-being and continued partnerships.
All right.
Yeah, there you go. Everybody gets about 9 minutes back of their workday.
Thank you.